Hi, my name is Abby Lewis. The first question is describe the importance of emergency splinting. It is very important to emergency splint a fracture to immobilize it whenever the athlete first has the injury. So the site where they are when it happens is when it needs to be emergency splinted. This is important because it immobilizes the fracture and makes sure that whenever they are moved, that further tissue damage won't be caused, hemorrhaging won't happen, and shock. It is better to focus on getting it right from joint to joint, wherever it may be, as well as making sure to do it in the way it was found. Don't mess with it, move the athlete before it is emergency splinted. You need to splint it and then wait till emergency services get there, emergency medical services.
In the event of a medical sports emergency, a sports medicine professional or an athletic trainer should be responsible for taping an athlete or splinting an athlete in the need for it. And they're trained to do this, and they have the most experience with this. So it wouldn't make sense for anyone else who doesn't have any experience to do this.
The next question about a body part, I chose the knee. For material you need an ACE bandage. The athlete needs to be sitting down with their legs outstretched in front of them. Starting with the end of the ACE bandage, you need to go on the kneecap, right in the middle of the kneecap, so where it's just sitting right in the middle of your leg and the kneecap. And you need to wrap it around itself. Make sure that the end is covered by the ACE bandage. You need to do that twice, wrap it around itself on the knee, or wrap around the knee twice. And then after the second time, you need to go above the kneecap, so like on your lower thigh, right above the kneecap, and then you go down like a figure 8 across the knee. Make sure that there's no folds where the bend of the knee is on the back, because if there is, then you won't be able to bend the knee properly and it'll bunch up. And then go across the bottom of the kneecap, so the lower part right on the top of like your shin, and then go back around, and you should be at the end of your ACE bandage, and you will attach it to the top of the knee. And then the things that could go wrong is if it's too tight, it will cut off circulation and could cause swelling in the lower leg. And if it's not tight enough, then it will not provide proper support and it might slide down the leg. If there are folds in the back, this is another thing that can go wrong. If there are folds in the back, then you won't be able to bend your knee properly, and it just won't have, again, the proper support that you need and the proper movement for your leg.
To do the lower leg spiral wrap, it's commonly used in sports for covering like a large area, specifically like your lower leg. And the materials needed for this is, depending on the size of the area, a 3 or 4 inch wrap is required. So for the position of the athlete, if the wrap is for a lower limb, the athlete bears weight on the opposite leg. So obviously, if the one you're wrapping, you can't bear all of your weight on it. For the procedure, step 1 is elastic wrap is anchored at the smallest circumference of the limb and is wrapped upward in a spiral against gravity. Step 2 is 2 pieces of tape should be folded lengthwise and placed on the wrap at either side of the limb, or a tape adherent can be sprayed on the part. Either one of these work. Step 3, after the wrap is anchored, it is carried upward in consecutive spiral turns, each overlapping the other by at least half an inch. And finally, the wrap is terminated by locking it with circular turns, which are then firmly secured by tape. And an area this could go wrong in is if you don't have tape or you don't have that spray adherent, the wrap may slide down to a moving extremity if it's not added. So the wrap would be no good after that if you don't have it secure.
For the video on how to tape an ankle, what did the certified athletic trainer do? Well, he was very thorough. He explained why he would do everything, such as why he put pre-wrap down before, so the tape wouldn't stick directly to the leg. He would explain the motions that he's doing, like the stirrups and the horseshoes, and you could see what he was doing. He was very thorough in showing, as well as talking about the RICE principle of rest, ice, compression, and elevation, and why that would be important, as well as wrapping an ankle. He was very thorough in his video on explaining things, but any areas that he could improve upon, it was very fast. So if you were trying to learn other methods of taping ankle or, variations, he doesn't really go over that. He also doesn't explain about the importance of how the ankle should be angled and how the foot should be angled when it's taped. So it can kind of be hard to keep up with what he's doing, like when he's going really fast in the video or, understanding some things. But it would be a good video to watch just to see one way of quickly taping an ankle. Yeah.
For the how to tape an ankle video, I thought the athletic trainer did a really good job of explaining what exactly he was doing in the areas of the ankle and foot he was doing the techniques on. And I thought he did a really good job of explaining what each thing was used for. But I feel like he could have slowed down and took his time actually doing the steps, but I thought he did a good job anyway. And something to remember that he could have done better or mentioned is that an athletic trainer cannot tape an ankle if it's not dorsiflexed. And I think this video could help someone who wants to learn how to tape an ankle effectively. So anyone who wants to be in the athletic training field, or maybe any sports medicine professional who wants to learn, and they'll be able to watch this video multiple times and they'll be able to practice and perfect their technique.